Back with another episode of All Bells, No Whistles, sitting with Dr. Max Baum. One thing that you brought up in our last conversation was acute athlete injuries, hamstring strains, ankle sprains. We hear about those a lot. We don't see them because usually they happen on Saturday or Sunday, and then they come in Monday, Tuesday, and Wednesday, and then tell us about them. So obviously we don't see them, but we hear about them. And so then, our follow-up is, well, what have you done for it? Did you go see somebody? And a lot of times the athlete's like, well, I just been icing a ton. And for some reason, we can't get past the point of, that the whole RICE idea, rest, ice, compression, elevation, right? What was it? In the 70s, dude came up with that. And then like 10 minutes later, it's like, I lied.
Yeah.
But the world has grabbed onto that so tightly.
Yep.
And, and understanding to an extent, right, that the swelling or the inflammation is the body's healing properties trying to go to work.
Yep.
And then we slap ice and we're like, no, you cannot heal. Inflammation be gone.
Yep.
Right? Like, so we try to talk to the athletes through that. So from your end, athlete gets hurt Saturday, Sunday, rolls the ankle pretty good. What does treatment look like on your end, or what should it look like for the athlete?
So yes, thank you for bringing up RICE. RICE is very outdated and just shouldn't be implemented anymore. On my end, if say somebody has a pretty severe ankle sprain Saturday morning, personally, I'd love to see them that day if I could. What I would do and how I'd go about treating an acute ankle sprain is my goal is to increase circulation, increase blood flow to that area. So biggest thing I'm going to do is probably throw a bunch of needles into that area. Dry needling is an awesome way to increase circulation in this small little area. And if we can throw a bunch of them in there, really help blood flow come into the area, is going to continue to speed up healing. What ice does is it just stops blood flow and decrease the onset of healing however long you're icing it for. After needles, it's going to be a lot of movements. I'm going to have you walking on it. I want to load it a little bit. I want to have you keep your range of motion as best you can through that swelling. And then the next day, we can kind of progress a little bit more. You see a good amount of success within a week of getting that ankle pretty back. Sometimes you'll have a little flare up in that week, and after 2 weeks you should be back to going full speed.
So is that same with a hamstring? Like say they feel a little niggle in the hamstring, or even groin, quads over the weekend. What does that look like?
Similar, a little different. So with ankle sprains, you're injuring a ligament in that ankle, and ligaments have a little bit less blood flow than muscles do. But muscles also are a lot easier to re-injure if you don't treat it right. So with the hamstring strain, you're straining, or a strain in general, you're straining that muscle. You're adding some little tears to it. So again, I'd want to needle it. That would help, again, bring blood flow to that area. But the loading is going to be a little bit different. So we're going to start with a little bit of isometric load. That really just helps add a little bit of load to the muscle, but not overstretch it or overdo it. And as we progress in the following days, we can begin some concentric exercises that then lead to eccentric. Eccentric are going to be the ones that cause the most tissue damage in a good way, a good stress, but they cause the most load as well. So Nordic hamstring curls are the easiest ones for all your athletes to know, because you guys love hamstring curls, Nordic hamstring curls. That's kind of the end stage rehab for hamstring strains.
Nice. So athlete gets hurt Saturday, Sunday. They try to get in with you. Mm-hmm. They can't. What do we want to make sure they do at home until they can get seen? That isn't icing.
Yep. Awesome question.
Do not ice. But what can they do at home?
Move it. Walk on it. It might hurt a little bit. You don't have to go on a 2-mile walk, but add some load. Walk around the house a little bit. Don't be afraid to move it. Keep range of motion going. So do what we could just call ankle circles or ankle cars. Just keep that range of motion as best you can. Or with the hamstring, don't stretch it. Both either of these, heat is great. Way better than ice. Heat's great, but movement's better.
Okay.
Movement, the more you move, the more you'll be able to tolerate pain a little bit more. And then it's just going to continue that circulation of blood through the area, and then healing is starting right away.
So just to make sure, since some of these athletes, they want to get right back to playing.
Yep.
Obviously, if we got an ankle sprain it's at a level where we know we're not playing.
Yep.
Is there too much movement that we can introduce? Like, is there too much walking around the house or too much just walking in general? Or is there no such thing as too much if it's low intensity, obviously?
There could be a level that's too much. If your pain starts to increase,
okay,
then it may be, hey, back off a little bit. Rest is not bad. Rest is a good thing. But I think the most important part of all of it is just get good sleep. Sleep is when pulling this number out of thin air. 75% of your healing is going to happen. It's a lot of it. What you do during the day is super important, but quality sleep is going to help you recover faster than anything that we can do.
Cool, man. I like it. Where can they find information on you? Where are you putting out content? How can these athletes see what you're up to?
Instagram's awesome. Explore_motion. That's where all my content's being put. My website also has a lot of answers to a lot of the questions you might have, and that's exploremotionks.com.
Fantastic. Awesome. Another great conversation. Always good sitting down.
Always. Thanks again.
Yeah, man.